call Melissa. Oh, there we are. Welcome to the Health and Government Operations Committee voting session. Melissa, would you call the roll for us, please?
Sure, I'd be glad to.
Thank you.
All right, Pendergrass,
Yes, here.
Melnick,
Yes, present.
Bagnall,
Here.
Barron, Delegate Barron,
I see him. He's there.
okay, great.
He must have a bad connection.
Bel Castro, Bondari,
Yes.
Carr,
Here.
Charles,
Here.
Chisholm,
Here.
Collison,
Here.
Hill.
Hi, Stevie.
Got something wrong with my boot. This isn't just late.
Okay, take it with you.
Hill, Johnson,
Here.
Kelly,
Here.
Kerr,
Here.
Tipke,
Present.
Krebs, Lewis,
Here.
Morgan,
Here.
Riley,
Are you gonna play yourself today? What? Are you playing?
Rosenberg, Saab, Saab,
He's there. I see him.
Present, I'm here.
Semple Hughes,
Present.
Shaleka,
Please. Just give me a
Shaleka, and Lewis Young.
Here.
I'm coming back.
So we have 6 members absent right now.
Okay, thank you very much. Tyler, are you there?
Yes.
Tyler, did you put the bill, the Hester bill on this list?
No, it's not on the list.
Well, it's on the list now. Can you do that fast?
Yeah, I'll send out the amendment to everyone.
Okay, thank you. That would be good. Then when we get to it, and you're not first on the agenda here, so they'll have it by the time they need it. Thank you.
Tyler, what is the bill number?
Senate Bill 69.
Okay, thanks.
Sent in.
Okay. So we'll start with House Bill 548. Erin.
Madam Chair, is it okay if we skip the first 2 House bills and work off the Senate bill,
Yes,
their Senate
it
bills?
is. Yep,
Thank you.
that's fine. Thank you for the suggestion. Senate Bill 67. Erin.
This bill was discussed this morning in the Public Health and Minority Health Disparities Subcommittee. There are amendments that were distributed to the full committee. The amendments retain current law authorizing a paramedic to administer influenza and hepatitis B vaccinations, public safety personnel, and would authorize paramedics to give these vaccinations to ambulance service personnel. The amendments authorize paramedics to give flu and COVID-19 vaccines if the immunizations are provided under the direction of an EMS operational program medical director authorized by MIMS, part of a population health outreach effort, and provided in accordance with a written agreement between the paramedics EMS operational program or ambulance service and the health department in the jurisdiction in which the services are performed or in a hospital or by a hospital. It requires MIMS to study and report to HGO and EHE on efforts to include paramedics in public health vaccination programs. That report would be due December 1st, 2021, and it would sunset that second provision of the bill where the paramedics could give flu and COVID vaccines. That would sunset on January 1st, 2023. This was not voted on in the Public Health Subcommittee, but it was discussed.
Delegate Penny-Melnick.
Thank you, Chairman. And I want to thank Erin for doing all that work since this morning, because this morning we did gather everyone, Delegate Kelly, Delegate Kipke, Delegate Carlson, the chair, and people from the insurance providers and others. And we had a great discussion on the bill. And we felt that something's needed to be done, but that this is not the time yet, that we see what the real impact is. So this is a compromise that you have in front of you, and it will help during the pandemic. And I would ask for the amendment to be, I move the amendment.
Second. Is there any discussion? I see some hands up. Let's start with, let me start with opening my panel so I get the order that the hands went up. Delegate Johnson, followed by Delegate Saab.
Thank you, Madam Chair. I had some questions on this bill after subcommittee, so I called the Maryland firefighters liaison, and Jimmy Malone said to tell you hello, by the way. And he told me, he explained it a little more, that a lot of this is firefighters and EMS when they are off duty. My concern was that they are very busy and this would interrupt their schedule of what they normally do. But he said that like on these mass vaccination sites, that a lot of them are going to be working there during hours and when off duty hours to help get these shots out to folks. So he said that the firefighters, the EMS and EMTs were 100% behind this bill. So I just wanted to relay that to the committee. He said to tell you and the rest of the committee hello. Thank you, Madam Chair.
Thank you, Delegate Johnson. Delegate Saab, followed by Delegate Cullison.
Thank you, Madam Chairman. So with the amendment, would privately owned ambulance companies be able to also perform the vaccine up until 2023?
Aaron?
It's paramedics, so it would apply to them as well.
So there are some companies that are ambulance companies. I don't think they all employ paramedics that do like special events. Are they under this bill too?
I'm not sure what the question, what you're
So
asking.
there are some companies.
Exactly who is empowered in this bill to give vaccinations?
It would be paramedics who already can give certain vaccinations to public safety personnel. It would expand the paramedics' ability to give the hepatitis B, influenza, and tuberculosis skin testing to ambulance service personnel. That's one part of the bill. And then the other part of the bill would allow paramedics to give flu and COVID-19 immunizations if they're provided under the direction of an EMS operational program medical director, ambulance service medical director, or other qualified physician and authorized by MIMS.
So this applies to all ambulance companies, privately owned or government,
It would be if, yeah, I don't think.
as long as they have a medical director.
Yeah.
Okay, thank you. Thank you.
Okay. Next, I have Delegate Cullison, followed by Delegate Kipke.
Thank you, Madam Chairman. So I'm wondering how, thank you very much for the work on this. I think this is a really good start and step for us. But how does this address the insurance issue around who is going to be paying for these services?
Aaron?
Do you want me to take, I know that I did share with the insurers who were involved this morning. They were not concerned with the bill as drafted, that there would be an impact.
Okay, all right, thank you.
Delegate Kipke.
Thank you. I think Aaron meant to say the amendment as drafted.
I'm sorry, the amendments, the bill as amended. Thank you.
Yeah. So whoever wrote the amendment, she's very, very wise and talented, because this is the kind of amendment I was hoping to see on the bill. I like the idea of enabling, empowering people who are capable to help get the jabs out in the arms of people in whatever manner is necessary. I do have some reservations about the breadth of the bill And since this would be a major policy change, I think it's smart to just take a little time to look at it and think about, whether it needs any guardrails or not. This is the first time we've seen this bill. It's sort of a new subject. We don't know a lot about how they interact. I think there's some exciting potential with it where you might have in certain communities where there's the lack of vaccination of a particular illness, for example, and there could be some coordinated efforts to set up some vaccine clinics and use paramedics to do that work under the, through a coordinated way with a hospital or a health department. But I think it's important for us just to empower, as the bill does, to engage paramedics to help with the fight against COVID, but to take some time over the interim to really understand how they operate in the community. I didn't even know that the paramedics could do this, honestly, for themselves or others. I'm just learning about all of this for the first time. And so I like the way the amendment is written. It gets us moving forward in a way that's positive, but it also allows us an opportunity to take a deeper dive into the subject matter. So I speak in favor of the amendment. Thank you.
Thank you, Delegate Kipke. Delegate Hill.
Thank you. And I'm sorry that I know there was a lot of discussion about the amendment. Aaron, can you just clarify for me again? We're not taking anything away from the EMTs that they can already do, correct?
Correct.
We are allowing them to continue to do COVID vaccines, which the federal government has. We're allowing it to go on until 2023, similar to what we've done with the pediatricians or the pediatric vaccinations for the pharmacists, so that if the COVID state of emergency goes away, they have a period of time. Is that correct?
They'd still be able to get COVID through
Okay,
January 1, 2023, as long as they
thank you.
meet the provisions in this bill.
Okay, and what wasn't made clear, I thought, by the advocates is that they already have protocols in place for how they do this. And those protocols are established and they're under the direction of physicians, hospitals, public health people, correct?
Mhm.
So they have a lot of guardrails already in place. And, okay, and so with the amendment, what we're saying is yes for COVID, yes for the vaccines you already administer, but we're not ready to look at vaccines broadly. Is that correct?
It would be flu and COVID.
And flu and COVID,
But
the
not
other
beyond that,
vaccines, but
which the
not
bills
beyond
introduced
that.
went beyond that.
All right, thank you. Okay, I just wanted to be clear because we're not really giving them anything new. And the reason, as I understand it, to Delegate Cullison's point, the reason there's not an issue is because they're not out there on their own willy-nilly offering vaccine clinics. It's under the auspice of a hospital or the public health facility, or it's within their own community of EMT and firefighter personnel, correct?
Yes, and that's in the bill.
Thank you, okay.
I see no other hands. Does someone want to make a motion on the
I move
amendment?
the
Move
bill.
the amendment, move the
I
amendment.
move the,
Second.
And I should have asked for the subcommittee chair.
it's okay, it's okay.
Nice. I presume there's no further discussion. All those in favor say aye. All those opposed, no. Please raise your hand in the panel. I see.
And if I may, Chairman, we have Delegate Riley and Delegate Krebs are together so that the
Good.
staff can note and put them appropriately. They're both present.
Excellent. And Madam Chair, would you like to move the bill as amended?
Yes, yes, Chairman. I move the bill as amended.
Second.
Second.
Any discussion on the bill as amendment? All those in amended. All those in favor say aye. All those opposed say, raise your hand in the panel. The bill passes unanimously. And thank you for your patience with us doing this work in this body instead of doing it all in the subcommittee today. We felt it was important enough and we had the the brain bandwidth at this point to focus on what we needed to do. So I appreciate everybody's patience with this. Senate Bill 82. Lisa.
This bill requires individuals to be licensed with the State Board of Examiners for audiologists, hearing aid dispensers, and speech language pathologists by January 1st, 2022, in order to practice music therapy in the state. There are amendments that specify the representations to the public a licensed music therapist may make regarding communication disorders, and that clarify that a music therapist may work with a client who has a communication disorder and address communication skills.
Delegate Kelly.
Thank you, Madam Chairman. So this is the cross-file of a bill that we passed out of this committee unanimously earlier in session. We did work with stakeholders because an amendment, the request, sorry, I'm in my dark here. The request for an amendment came to us a little bit late. So I would like to thank the chair and the sponsor for working diligently to reach compromise that satisfied all of the parties involved. We heard this morning in subcommittee from the Music Therapy Association as well as the Speech Language Pathology Association that this language addresses the concern that the speech language pathologist has raised in terms of what language was appropriate for allowing music therapists to work with individuals who have communications disorders and making sure that music therapists would not be allowed to advertise that they were treating communications disorders. We also heard from the board that while this is not the specific amendment they were requesting, that the language was very much in the spirit of their conversations. And so they were, while they haven't met to officially change their position because of timing issues, they were confident that this would meet their needs. So the amendment passed unanimously with one abstention, I believe, and then the bill as a whole passed unanimous, but for one legislator who did not want to support a new licensing. So I move the amendment.
I see.
Second.
Thank you. Is there discussion, Delegate Barron?
Thank you, Madam Chair. Can I ask, and I'm sorry I didn't catch this on the previous or on the crossfile, but the penalty in the bill for doing music therapy without a license. What is it?
Lisa, do you know that? I'm trying to pull it up right now.
I think the answer is if you don't have a license, I'm not sure how they can police you because you're not registered and don't have a license. I think that's how it works with most boards, isn't it, Delegate Kelly?
I think what Delegate Barron is asking is if you are promoting yourself as doing music therapy, but you are not a licensed music therapist, what type of enforcement exists? Is that the question?
Yes. There are penalties in the bill, I believe.
Right. So I'm trying to pull them up. I'm sorry. I was pulling it up now, but Lisa, do you know what the penalties are?
I can tell you what it is.
Yeah, go ahead.
Sure. Madam Chair, I would like to respond to Delegate Barron's question, but it states in the fiscal note that a person who violates the prohibition against practicing without a license is subject to a civil fine of up to $50,000 to be assessed by the board in accordance with regulations adopted by the board. Does that speak to your question, Delegate?
I think so. So there are no criminal penalties?
What I see right at this given time speaks to that there can be a civil fine. I can keep looking, but that's the one that I see right off the top.
I'm looking too.
How about we hold this bill till the end of our voting session? And in that time, I ask staff to look at this and see if you can find the absolute answer. Since I was so far off, I've become curious now.
I have it as well, Madam Chair.
You do? Oh.
Yes, it's on page 3. I didn't scroll up farther enough, but on page 3, It says a person who violates any of the bill's provisions is guilty of a misdemeanor and on conviction is subject to a fine of up to $10,000 or imprisonment for up to 1 year.
Ooh. Is that more broadly applied, or is that just for music therapists?
I believe your question is, did different boards have different penalties? And the answer is yes. There's no consistency that I'm aware of. We have dealt with this issue from time to time of different boards trying to increase their penalties for different things. So I believe they're all inconsistent.
Delegate Barron.
Thank you, Madam Chair. I'm not a big fan of licenses generally, but this is one of the things that comes to the committee, and in particular, criminal penalties for many of these things and barriers to entry being a separate issue. I haven't done a great job of as these things come through, questioning them, but it is something that is particularly important to constituents of mine. Criminal penalties for things like music therapy. This really seems unnecessary. Unnecessary, maybe even have a license, but unnecessary if there is a license to have criminal penalties for such things. And so I'm uncomfortable with it. And that's all, for the rest of the committee's consumption to think about. But I may vote against the bill.
And I thank you, Delegate Barron, for raising this, because this is not something that came up in the subcommittee discussion of this bill, but it is something that has been very thorny for us on other bills related to licensing boards. I would not want us to run into a problem on the floor with other folks who also share those concerns. So I appreciate the issue being raised now. I don't know if there's something we can do to the bill, or if we have time to look at sort of what other penalties for these types of college graduate licensure programs are, and make sure that this is not out of line with what we exist. I don't feel prepared to answer these questions on the floor should they come up right now.
Did you get the answer that you needed, Delegate Barron?
Yes, I did.
Okay, I'm going to go to Delegate Hill.
Thank you. I think that Delegate Barron's hit a little bit on what I was going to. I had told Delegate Sanford Hughes I was really happy that she got the right board, because I knew this musical therapy was important, but it was important, as I understand it, because they need to be certified and licensed in order to bill for their services. So I'm wondering if the line we need to walk, to Delegate Kelly's point, is that we describe this license thing. The question I was going to ask is about how many people, don't get caught, have been practicing musical therapy, not being able to bill insurance, but are doing a service, but don't qualify under these official organizations, and therefore are going to be suddenly told they're not musical therapists. So I'm wondering if we can talk about a licensed musical therapist who comes under the board and is allowed to bill as a musical therapist, and say that there are other people who provide musical therapy who are unlicensed and cannot bill. In other words, the issue is about billing. That's why I thought, and Delegate Sanford Hughes or staff can correct me if I'm wrong, or Delegate Kelly, we worked so hard to get this because they wanted to be able to bill. And yes, there are fly-by-night people who claim to do musical therapy, but there's also this entry level thing. And I'm not sure if I'm being clear, but I'm concerned that there are people who are providing the therapy who won't qualify because they didn't get trained by these official boards or recognized boards. And I'm not concerned that they're fooling people and offering therapy. I'm concerned that we're blocking them from making a living that they have been living. And I think maybe the line we can walk is differentiating what you can do with this official certification, this board certification, and what you're not allowed to do. I'm just throwing that up. I don't know if that was clear or not, Madam Chair.
I think your point is actually a very interesting one. And I will say that this year in subcommittee, as we discussed it, the carriers were very silent. So we didn't hear from them. I would be concerned about, I think it's an interesting idea what you're proposing. If I understand correctly, you are interested in sort of broadening the list of folks who would be eligible for licensure to ensure that we have, in terms of the qualification that we have in the bill for licensure, right?
Well, I was actually thinking broadening it's fine, but I was thinking that what we're literally saying is in Maryland, you cannot advertise and bill as a therapist unless you are licensed, but you can provide musical therapy services. It's almost like a unlicensed professional recognition. Like I can go to you and have you cut my hair, right? You're not a licensed barber, but I'm not prohibiting you or having, criminal penalties because you cut my hair. But if you come to me and claim that you want to bill me there's a difference between what a licensed barber can do and an unlicensed barber. And we don't stop people from cutting your hair and even charging me $5 for it when I come into your house and do it. And I think that's.
So your suggestion is actually in line with Delegate Barron's, which is that we should be cautious about the penalties.
Right.
For folks who don't have licensure, with the acknowledgement that the licensure serves the purpose of allowing someone to bill.
Yes. And to bill insurance companies. Insurance companies do not have to acknowledge anyone who is not a licensed musical therapist for the purposes of insurance and billing, something like that. That's what I'm thinking.
I would like to talk to the sponsor of the bill here for a moment, to all of you, but I particularly am addressing this to her because I know how hard and in good faith she's worked on this bill for a number of years. Remind me where the House bill is? Can you do that?
What does that mean? I mean, what do you mean?
It's passed the House and it's being
Yes,
considered in
unanimous.
It's what? It's in the Senate?
Senate.
Right, okay. So we passed a House version that looks just like this?
Without the amendment that we added just now.
Without the amendment?
Without the amendment that we're considering. The Senate is waiting on us for this amendment in order to move the House version of the bill.
Thank you. Okay, fine. So I would like to say that I think we need to put this amendment on because I think it works. I think the penalty issue is a very broad issue and it relates to all the boards because they all have different penalties. I can't tell you that I know what they are, and if I did, you'd know I was lying to you anyway. We can't do this today. We can't deal with penalties today. That's not a realistic possibility. So again, I'm going to go back to the Speaker Pro Tem and say, I am comfortable passing the bill as it is. And the only amendment I don't want to put it in this bill because it's not just about this particular profession or this particular board. I think that we may need to write a letter to the department or to the board specifically and look at the penalties. The penalty issue is a very valid issue. But I would like to not have it stand in the way of this bill. But if the Speaker Pro Tem feels differently, I would like to hear what you have to say, please.
Sure. Well, Madam Chair, I would agree with you in the fact that the penalties, they run the gamut from the dental board to the art therapy boards and the alcohol boards. We even have penalties on some of those that we're dealing with right now as we speak. I heard just the other day regarding a $10,000 fine if someone sells more than 6 beers to a patron. So, I mean, they run the gamut, and I don't believe that this is the avenue of this particular bill to start working on that piece of issue that needs to be addressed throughout all of our policies here in the state of Maryland. So that's something that needs to be worked on, I agree, but not at this time or in this bill.
Okay, now I'm going to go back to my list. We've heard from Delegate Hill, so Banderi, you're next. Delegate Banderi.
Yeah, thank you. Thank you, Madam Chair. I do agree with you that these music therapy, thank you, by the way, Delegate, my subcommittee chair, Kelly, for doing a wonderful job on this. Music therapists, they have to hold a certain degrees, credential, issued through the certification board for music therapists. And what I do believe is, there should be some sort of safeguard to ensure that they do competently practice and they require continuation of education. And so I do 100% agree that there should be some safeguard. And if we don't agree on it, we can come next year and we can, have another bill.
Thank you. Delegate Krebs. And the last word will be Delegate Cullison.
Thank you, Madam Chair. Listen, I wanted to say, I think music therapy is a very valid and beneficial field. I mean, I don't want to underestimate that. But like all of these occupations, they ought to be practiced by capable and competent people. But licensure does not necessarily achieve this. And what it does is it makes the barrier so high to get into the field. I mean, some of these fields, I don't remember this one, you need a bachelor's degree, you need to do all of these things. And it really does have a barrier to people entering these fields. The issue that they all are pushing for is payment. And I think the committee would do ourselves a good service to understand why why do they have to be licensed to get paid to do something that we all believe is a good thing? Because licensure is a barrier to people to enter the fields. There has been no evidence of widespread harm or danger occurring from this unlicensed music therapist. And that's what licensure is about. And there's no reason to believe that any meaningful harm or danger associated with this activity will arise anytime soon. But the negative effects are there's a barrier to many, many people that want to get into this that now have to have all of these steps or hoops they have to jump through. And it's like that for many, many occupations that we are now trying to license. And again, I think this is a very valid, music therapy is very, very important and it's going very well. I've been in hospice for 10 years. We use music therapy all of the time. We have never had an issue with the quality of the music therapist. So my question is, Delegate Hill mentioned that it's a barrier maybe to payment. And maybe we should figure out on art therapy and music therapy and whatever new therapy may come up for licensure, what is the barrier to payment? Because I know in hospice, we still pay the people. They're not licensed, but we still pay them. So my whole objection to this is a barrier to entrance of people without having a bachelor's degree or all of these things they have to go through. And if you want to have specific titling, say you're certified music therapist with the AMTA or whatever, and you're certified somewhere else, the American Music Therapy Association. This is something that's nationwide. They're pushing these things because they want to raise the level of their profession, but there's no health and safety reason to license them. And I just want to reduce barriers to entry to these occupations versus put more burdens on them. And also the penalties are very huge. But it's a philosophical issue of just getting more people, reducing barriers to all these occupational licenses. In Maryland, we have some of the most barriers of any state in the nation. And I'd like to reduce some of these barriers for people. They just can't get to that unique licensure, the credentials that are required. But I don't want to diminish how important I think music therapy is, because I do. So
Thank you, Delegate Krebs.
Thank you.
Delegate Cullison.
Thank you, Madam Chairman. Am I understanding, and I think Aaron, this is a question for you, this language, and I'm looking at the Senate bill, page 25, where the fines are. That's all new language, right? That's not current statute, because what I was trying to look to see was whether or not the music therapists were just plugged into the speech language pathologist. So which is right?
It's all new language.
So, it's Lisa, not Aaron.
I believe it's probably based off of something, and I'm trying to figure that out.
I'm sure that it is, because I've seen that language before. So I'm wondering, and I don't want to complicate things, and we'll definitely go with the body, but if we took out the criminal penalty and made the civil fine of not more than $10,000, that feel more comfortable for now, knowing that we're going to have to deal with, I think Delegate Barron raises a really good issue, and we're going to have to deal with this in a broader scope in the future.
Lisa,
Yes.
this is not the same language that is there for audiologists or speech therapists or anyone else in that
So I
board?
was just quickly trying to figure this out, and I do not think it's the same that's used for the audiologists and speech language pathologists. Originally, this bill was drafted to the professional counselors and therapists article.
Right.
So I think that these penalties are more in line with what is in that title than what's in the title for the speech language pathologists and audiologists. I'm kind of flipping through pages here. I did just see similar language provisions for behavior analysts, which is under the professional counselors and therapists.
Okay.
I have not found anything.
Okay. We have one day. I don't want to rush this, but I can see there is a consensus that we need to figure this out, and that I made the assumption, again, wrongly, that it was already in the statute, and this is new language. Delegate Cullison, thank you for pointing it out clearly so that I understood it, and all of us, I think, now understand it. How about we have a look at this? Delegate Sample Hughes, are you okay? We'll deal with it tomorrow. We'll have another voting session at some point. It shouldn't be a problem. We should be able to get it through.
Yes. I'm just going to smile on this because this is getting really interesting. We're down to the wire. And given the fact that this bill was brought back for specifically an amendment to provide clarifying language to deal with the speech pathologist, now we're in a whole new space. But nonetheless, it's interesting, and we'll work on it, as you said, tomorrow.
Okay, I'm going to ask Lisa to take a look at this. Think about the language. Delegate Kipke, your hand is up again.
I was just gonna say to the speaker pro tem, if she needs me to talk to the speaker to get a couple of sessions in the same day, I'm in for you, because I think it's nice to get this bill done. But and I know you got the pool of the century around here, so I think we'll be all right. And I don't want to hold you back with getting this bill passed, because I know people in my community that have really been helped by this, especially kids with autism. And we certainly want people who are trained to do that kind of work. So, but with everybody working together, I really believe we can get it done.
Sure, as long as the needle doesn't move too much to another direction.
Delegate Sample Hughes, and this is a surprise, I think, to many of us, certainly to me. But it's a legitimate concern. And I really did think that this was in the existing statute because of the board. So we're going to look at it. We're going to get this out of the committee sometime tomorrow, hopefully before the second session. And we will make sure it gets through. It's a Senate bill. They will have to fix their bill so that they can form, but there is time to do all of that. And I'm sure that between all of us, we certainly should be able to get it done. Okay? Okay, we're going to hold this bill and figure it out. Thank you all. That was unpleasant in its timing, but it was a good discussion, and hopefully we'll make it as good as it can be and then move it forward. Senate Bill 106. Tyler, are you ready?
Yes, Senate Bill 106, as it came from the Senate, would require that when certain people or businesses go to apply or renew a license with certain state agencies, the applicant must be in good standing with the State Department of Assessments and Taxation before the permit or license can be granted. In some committee, an amendment was adopted that would carve out individual people. So it would only be if corporations, so not natural individual humans, would be subject to this requirement.
Delegate Rosenberg is not here. Is there someone on the subcommittee who might be able to talk about this? I'm thinking there must be.
I don't know if Delegate Barron is willing to do it. I know I was doing both Latino caucus in this meeting, so. I don't
Delegate
know if
Barron,
anyone else-
do you feel equipped to talk to us about this?
I'm sorry, which bill are we on now?
Senate Bill 106, licensing good standing with State Department of Assessments and Taxation requirement.
I am not prepared on that one.
I'm going to hold it till tomorrow. Senate Bill 299, Aaron.
Senate Bill 299 establishes the Commission on Trauma-Informed Care as an independent commission in the Department of Human Services to coordinate a statewide initiative to prioritize the trauma-responsive and trauma-informed delivery of state services that affect children, youth, families, and older adults. The Governor's Office of Crime Prevention, Youth, and Victim Services will provide staff to the commission, and the commission, in consultation with specified entities, is required to study and implement an adverse childhood experiences aware program. The bill requires each commission member to participate in trauma-informed care training. This bill was in the Public Health and Minority Health Disparities Subcommittee this morning.
Delegate Pena-Melnick.
Yes, we discussed the bill. Delegate Lewis, Robin Lewis spoke on the bill and why it was needed. And we took a vote. The vote was unanimous.
Is there discussion? Want to move the bill or are there
Yes.
amendments? Did you
Move the
say?
amendment.
There are no amendments.
I move the bill.
Move the bill. Second.
Discussion? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. Senate Bill 5.
Madam
Yes?
Madam Chair, at this point, if you would like to take House Bill 548, that is the cross file to this bill.
Are they in the same posture?
House Bill 548 would need amendments that conform
Move the amendments to conform the bill.
Second.
Discussion? All those in favor say aye. All those opposed, no. Please raise your hand. The amendments pass. Would you move the bill?
The bill as amended.
Second.
Discussion? All those in favor say aye. All those, Delegate Krebs. Delegate Krebs.
Trying to find my unmute. I just want to make a comment. I noticed in the letter of information from the Department of Health, we already do a lot of different things for these adverse trauma-informed care. And I think as a committee, I know we passed a lot of these bills over the years. How do we make sure that they all are being integrated? Because they list a whole bunch of things we've done over time, and it seems like we're doing things, we do a little here, a little there, and then we're doing this. And we never go back and look at, we got Handle with Care program we did a couple of years ago. We have the ACEs program that we did a couple of years ago. And we never go back and look and say, how's that going? And then we put this in. So I would just ask, if we're going to do this, that somehow they look at all of the other things that we've done and we follow up, because we just keep doing new things and we never go back and see how the things we've already done are doing. If you know what I'm saying, we just keep adding
We
things.
know what you're saying. Thank you, Delegate Krebs. Delegate Pena-Melnick, can you answer her question?
Yeah, in the bill, it says that they have to work with the department, and in the bill, we also provide money for the funding, and there's also reporting as well. And this is basically a coordinated effort to bring everyone together, from all the efforts that are being made, and the department will be part of it.
Does that answer your question, Delegate Krebs? I'll take that as a yes. Delegate Lewis.
Thank you, Madam Chair, Madam Vice Chair. If I may, to try to get to the heart of Delegate Krebs' question, she's right. There are a number of initiatives, pilots, programs in the Health Department, in the Department of Education that touch on adverse childhood experiences, that touch on trauma-informed care, because trauma-informed care exists in both the education code as well as the health general code. But the beauty of this commission is that it will do exactly what you're, imagining, what you're striving for, which is a unified, coordinated, program that pulls all the threads together, oversees them, analyzes them on an annual basis, reports back to the governor and the General Assembly, and allows us, iteratively to continue learning from all that's happening and improving it. So this bill creates the structure you're asking for. Thanks, Madam Chair.
Thank you,
I
Delegate
know.
Lewis.
Thank you.
Any other questions? I see none. You could take your hand down, Delegate Lewis, because we're about to vote. All those in favor of the bill as amended, please say aye. All those opposed, no. The ayes have it. Bill passes unanimously. Senate Bill 565.
Senate Bill 565 is the cross file to House Bill 309, which passed this committee earlier this session. There is an amendment that was adopted in the Public Health and Minority Health Disparities Subcommittee this morning, and that amendment would fold in the provisions of Senate Bill 796, which is a very similar bill to Senate 565. The amendments would require the healthcare disparities report card to compare the racial and ethnic variations in insurance coverage for low-income, non-elderly individuals and the racial and ethnic composition of individuals licensed or certified by a health occupations board with previously published report cards that included the same information. Also adds a report that will be due by December 31st, 2021 from the Office of Minority Health and Health Disparities in coordination with the Maryland Healthcare Commission and the Department of Health to submit a plan to the General Assembly on goals and implementing actions to eliminate minority health disparities. And this was in public.
Tanya Melnick.
Yes, so this is Senator, wonderful Senator Ecker, and she actually agreed to fold the bill into this bill. And it's one of the recommendations from a work group that the Senate held. And I move the amendment.
Second.
Is there discussion on the amendment? All those in favor say aye. All those opposed, no. The ayes have it. I see no hands. You want to move the bill?
I move the bill, Chairman.
Second.
Is there any discussion on the bill as amended? All those in favor say aye. All those opposed, no. The ayes have it. The bill appears to pass unanimously. It passes unanimously. Senate Bill 697. Tyler.
Senate Bill 697 changes the current law, which right now prohibits purposes of the MBE program for a business that is owned by a woman who is a racial or ethnic minority to count to both as a business that is owned by a minority and both as a business that is owned by a woman for purposes of MBE participation goals and regulations. So if enacted now, such a business would count as both woman-owned and minority-owned for purposes of MBE goals.
Delegate Rosenberg is not here. Is there someone who can talk about this bill?
I can speak on it. This is actually was sponsored by the great Senator Edgar. And it's basically a straightforward bill that it acknowledges that minority women business owners generally have a tougher hand dealt to them. And it's a pretty straightforward. I believe the vote was unanimous. Am I right, Tyler?
That's, in my notes, it was unanimous vote.
Thank you.
Move the bill.
Is there discussion?
Second.
Oh, thank you, Delegate Kipke. All those in favor say aye. All those opposed, no. Please raise your hand. The bill seems to be passing unanimously. Aaron, Senate Bill 777.
Senate Bill 777 renames the Maryland Prenatal and Infant Care Coordination Services Grant Program Fund as the Maryland Prenatal and Infant Care Grant Program Fund and expands the fund's purpose to include awarding grants to federally qualified health centers, hospitals, and providers of prenatal care. The bill increases the amount of funding the governor must provide for the funds in the annual budget from $100,000 to $1.1 million in fiscal 2023, $2.1 million in fiscal 2024, and $3.1 million beginning in fiscal 2025. The additional funding must be used for grants to FQHCs, hospitals, and providers of prenatal care. And beginning in calendar 2023, the Secretary of Health must submit a specified annual report by December 1st to the Governor and General Assembly. This was in the Public Health and Minority Health Disparities Subcommittee this morning. There are no amendments.
Delegate Penny Melnick.
Thank you. So we had a discussion on this bill from stakeholders and the senator. Everyone participated. Basically, you know, there are women that are not able to get prenatal care and have gone to the hospital to give birth without having ever been seen by a doctor. You know, we, Maryland, have a lot of issues with maternal mortality and the rate in certain communities that was spoken to this morning. We took a vote and the vote was all present. It was unanimous except Delegate Riley was there, but she was in another meeting like a lot of us. And she did not get to vote and she would have been no, she said. So I moved the bill.
Second.
Delegate discussion, Delegate Kipke's hand was up first, then Delegate Chisholm.
Thank you, Madam Chairman. I just want to confirm something. There's conflicting testimony that I just want to see if Aaron could clarify for us. As you know, some of us here are pro-life, and one of the organizations is suggesting that these dollars could be used to fund organizations like Planned Parenthood or other similar organizations. But the Catholic Conference, on the other hand, tells us that they don't believe that that's true. They actually think that this is a bill that supports the pro-life position because it helps moms have healthy babies. I was looking at the bill, and the bill specifies it's for prenatal care and describes the care to include behavioral and oral health necessary for maintaining a healthy pregnancy. And obviously we do have a high infant mortality, preterm and low birth weight problem in Maryland. So I want to be doing all that I can to support that. I just want to make sure that I'm not doing anything that would, I mean, there's a lot of money in this that's putting in this bill, you know, that will put into future requirements on the budget. I want to make sure that I am representing my beliefs properly and that these dollars can't be used for organizations that would result in abortions.
I may have missed what you said. Are you trying to change this bill in some way?
No, I just want to verify. I mean, we have conflicting testimony, and I want to verify that these grants don't go to providers of abortion. I just wanted to be on.
They don't go to providers of abortion, or that they don't go to funding abortions? There's a very big difference there.
Yeah, no, you're right. These dollars will be used exclusively to support moms with to have a successful birth. Is I guess I want to make sure that that's where these dollars are going.
And that's my understanding. Aaron can confirm it or deny it.
Yeah, I mean, it's for FQHCs, hospitals, providers, and you read necessarily for maintaining a healthy pregnancy.
Right. So Johns Hopkins, for example, I do believe that they provide abortion services, but they also provide a lot of births. So the dollars used at Johns Hopkins through this program, for example, would be used to target at-risk pregnant moms to help them have a healthy birth. And it wouldn't be used to help them terminate their pregnancies through abortion services.
There's also language in the bill that the grants would be used to improve health outcomes of pregnant women. And there's also a report that comes back to you all each year on the grants provided and the programs. So you would have information.
And do we get those reports now already?
I think that's new on this program.
Okay, great. So we'll be able to look at this to understand how the money's being used in the future. Okay.
Yes.
Thank you. Thank you,
My
Madam.
pleasure. My pleasure.
Yours is the only hand I see. Delegate Penny Melnick, did you move the bill?
I moved the bill, yes. I'm moving the bill now, I think.
Okay.
Second. Sorry, it's been a long day. Forgive me.
It has. It already has been a long day for many of us, I'm sure. The bill has been moved and seconded. Is there any further discussion? All those in favor say aye. All those opposed, no. Please raise your hand in the panel. I see no hands. I see Delegate Krebs's hand. I see Delegate Saab's hand. Delegate Chisholm's hand. You're lucky I'm so patient and I wait for you guys, I'll tell you. All right, I have 3 no votes in the panel.
Delegate Krebs, are you including Delegate Riley with your vote? Is she still with you?
I don't have a hand up for Delegate Riley, and unless somebody speaks up, Delegate Riley's vote is not in the no. Okay.
Madam Chair, I just want to mention that the reason that we're not on is because we don't have any internet connection, and she was trying to be on with me because for some reason.
Is she with you? Is she with you, Delegate?
She went back outside to try to get on, but we have not been able to get internet connection, so we were trying to be on the phone. So
she's not on. She's not on.
I would count her as not here, yes.
So she is an absent vote now. She is until we see what, Krebs?
I would say yes. I think she's absent because she left me and tried to get back online.
Well, I don't see her on and she's not with you. So she is definitely absent. So she is absent. If there's anybody else that is missing, it would be nice to know that. It would be nice to know when people have to leave. Delegate Krebs,
I don't know if Delegate Shalaga is on either because we've had trouble getting on. Came to eat lunch and we cannot get Wi-Fi connection.
Delegate Shalaga, if
Delegate
you do not respond.
She's never been on. She was never
Okay.
here to begin with.
Fine, then she's registered absent. Okay, thank you very much for everybody pitching in to help people be recorded appropriately. I appreciate that. So the people who voted against this, I only have Krebs now. But did somebody take the roll of the 3 people who vote, or some number of people who voted no?
Yes, we have it. Thank you.
Chisholm, is there a 3rd one or not?
Yep, we have it. Thank you.
Krebs, Chisholm, Saab. Okay, thank you. I just want to get it right. I don't want anybody voting away they didn't intend to vote. You can take your hands down now. Thank you, Delegate Krebs.
If I may, Madam Chair, may we move House Bill 1349 as well? Can we do that, please?
And you would have to,
yes. And
that you'd have to amend to match Senate Bill 777. So
I move Senate Bill 1349 to in the same posture as what we just did with the Senate bill. Move the amendment.
Second. Discussion. All those in favor say aye. All those opposed, no. Raise your hands, but I'm going to assume it's the same 3 people who voted no last time, or was that 3? I only see 2 hands this time. Saab, do you have a hand to put up there?
For you.
You voting
I'm sorry,
no
which
again?
I'm sorry, which bill was that, ma'am?
This is the cross file to the bill you just voted against, I believe.
Then yes, I'd like to be consistent in the no.
That's fine, thank you.
Thank you.
Oh, wait, was that the bill? That was maybe the amendments, but we'll just have, are you guys okay being in the no on the amendments, or do you want to be yes? I'm sorry. Okay, so now we need to move the bill.
I move the bill, Chairman.
Second.
As amended.
As amended.
Okay. All those in favor say aye. All those opposed, no. Please raise your hand. I see Krebs, I see Chisholm, and I'm going to see Saab. There we go. Thank you very much. Okay, so that bill will pass in the same posture and with the same votes as the other bill. It's the cross file.
Thank you very much.
Bill that we added, Tyler, that got done in subcommittee.
Senate Bill 69 is titled Cybersecurity Coordination and Operations Establishment and Reporting. It is officially cross-filed with House Bill 879, but it came over in a different posture. The subcommittee voted to amend it so that it would be a study. It would ask the So as amended, Senate Bill 69 would ask the Maryland Cybersecurity Council to study certain aspects related to cybersecurity coordination operations in the state, including specific concerns that were brought up before in the hearing and in subcommittee conversations, such as balance of power, separation of power, concerns of local governments, and so forth. And the council would report by December of this year.
I can take it if the chairman would
Can you
like.
take this one? Thank you,
Yes,
Delegate Penny-Milne.
Thank you. So the subcommittee felt it was far too much of a commitment and change of a policy for the state to take. And discussing it, we basically turn it into what you have in front of you. And it was actually voted favorable with amendment unanimous after that discussion and that compromise.
Okay,
And
so
I
the
move the
original
amendment.
bill. Thank
Yes.
you. Is there a second on the amendments? Discussion?
Second.
I see no discussion.
Move the bill as amended, Chairman.
All those in favor of the amendment say aye. All those opposed, no. The ayes have it. It looks to be unanimous. Now. Delegate
I move
Penny-Milne.
the bill as amended.
Thank you. Is there a second?
Second.
Is there any discussion on the bill as amended? All those in favor say aye. All those opposed, no. The ayes have it. Thank you. I know this was a long process on that bill. I appreciate the work that subcommittee did, and the bill passes unanimously. That is what I have on my list. I'm sorry we have two held bills, but we're going to do our best to get them out quickly. So expect a voting session before the second session tomorrow, because I really do want to see how fast can we put them on a calendar and get them sent to the floor. Melissa, do you know?
We can do it same day.
Chairman
An hour?
Yeah, that should be fine.
Okay.
Chairman
Okay.
Pendergast, I also have a concurrence if you want me to do that, or else I can wait until the next.
No, let's do what we can. I'm trying not to leave things that, and if anybody has come online that feels they can explain, well, never mind. Let's go with the concurrence.
This is for House Bill 554, which was the Division of Consumer Protection Assisted Living Programs Bill. Delegate Pena-Melnick is the sponsor. The bill requires an assisted living program that was appointed as a representative payee for residents to report specified information to the Consumer Protection Division of the Office of the Attorney General. The Senate amendments require the Office of Healthcare Quality to notify the division of the appointment of an assisted living program as a resident's representative payee within a reasonable time after being made aware of the appointment. And the Senate amendments make House Bill 554 identical to its cross-file Senate Bill 507 as it was amended in the House.
Move to concur.
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. We will concur.
Madam Speaker?
Yeah.
Madam Chair, do you want me to explain SB 106 real quick?
Is that the one we held that from your subcommittee?
Correct.
Yes.
Good, sure. If you could do that.
So currently, in order to achieve a certificate of good standing, you have to file your personal property taxes. And if you ever go to sell a property, you have to obviously file to be brought back into good standing. Right now, you can apply for a new license, whether electrician, HVAC, plumber, and it doesn't background check that SSTAT certificate of good standing. What this bill seeks to do is, before issuing a new license or a renewal license for one of these trades, you have to have filed your personal property taxes or the necessary taxes required by the state to bring that certificate back into good standing. So this is just another layer for them to say, before we renew any license or offer any license, you have to be in good standing with the Department of Assessments and Taxation. I hope that makes sense.
So that is exactly describes the bill as it came over from the Senate, but the amendment adopted in subcommittee carved out. So some of the examples, individuals who would be licensed to practice a certain profession, and then sole proprietorships. So if a plumber in both sides, both they're licensed to practice, but also if they own their own company, maybe have 1 or 2 employees, they would be carved out. But then corporations and their licensed to practice. Security guard companies actually is one that came up when I was reviewing. So if you are a professional security company and are not up to date or in a letter have a good standing with the department, then you would have to fix that first before you could be renewed to be licensed to continue serving as a security agency in the state. And that was the amendment adopted in subcommittee unanimously.
So if the committee feels comfortable with this bill as amended, I would like to move forward with it. If there's discomfort in understanding this bill, I would like to go back to the plan to hold the bill. Would you raise your hand if you have any discomfort with the bill and the posture that it's in before I take it up for a vote, before I have it moved? I see no hands. So I'm going to ask Delegate Chisholm if he'd like to move the bill.
I would like to move the bill as amended.
Second.
Is there any further discussion on this bill? All those in favor say aye. All those opposed, no. Please raise your hands.
And Delegate Morgan's not here, correct?
I don't hear him saying he is here, so I'm going to assume he's not here. If Delegate Morgan is there, you need to say, hi, I'm here. Correct, he's not here. And Delegate Riley, I presume, is still not here. Okay, so do you have the votes, my staff, on this bill? Unanimous of the members who are present?
Yes, we have it. Thank you.
Thank you very much. Okay, so I'm hoping to start working on the music therapists very shortly today. We'll hope that we can figure out what needs to be done on that. And we will be seeing you tomorrow. I think we're coming in at 10 in the morning. That's my memory. So assume we will have a voting session. Are there any subcommittees meeting tomorrow? Staff, Aaron, Tyler, Lisa?
No.
That was one. Are Lisa and Aaron still here?
Not at this point, but there's a possibility.
When would that be?
Anything for public health?
Again, I don't
It would have to be after first session, correct?
Yeah. Mhm.
Okay. Okay. Delegate Hopwood? I mean,
You keep doing
Lisa.
that.
I mean, Aaron.
There's nothing scheduled for public health at this point.
Thank you very much.
You just
Okay.
got demoted.
We will have a voting session probably close to after the first session ends, or if there's lots of time, you might get lunch in there. We'll see how the day goes. Thank you very much for all your hard work, everybody in your subcommittees, in the committee, on the floor. We're almost there. How many days after today? 1, 2, 3. Have a nice evening. Bye.